Hi, I'm Dr. Maryam Lustberg. I'm a breast medical oncologist from Yale Cancer Center in the US, and I'll be talking to you about a trial in progress called Repower that we are presenting in the San Antonio Breast Cancer Conference in 2025. I do want to acknowledge the GRASP Scientific Advocacy Organization who selected this poster as one of their featured posters that we're going to do a virtual poster walkthrough later this month, and is featuring a dear patient advocate that unfortunately passed away from metastatic breast cancer. So this is Repower. This is a multi-center international study of 12 countries. And it's asking a very important question about real-world data in higher risk early stage breast cancer, stage 2 or stage 3 hormone receptor positive HER2 negative breast cancer. Based on the NATALY study in the United States, we do have approval for using the CDK4/6 inhibitor ribociclib for these higher risk individuals to help reduce the future risk of recurrence. We know from prior work that the clinical trial population may be a little bit different than how the real world study population actually performs. So the purpose of this study, which will include multiple patients, over 2,000 patients are planning to be enrolled in this international study, is to gather real world data on how ribociclib is being used and how patients do with ribociclib in the real world. And so as the patients enter the study at the time of the planned initiation of adjuvant ribociclib, they would have to meet criteria for being treated for ribociclib, and then they will go on to have multiple measures, including looking at their disease outcomes. They will be followed for 3 years, looking at effectiveness of ribociclib in combination with endocrine therapy. So this is the primary objective. But a number of really important secondary objectives will also be evaluated longitudinally during the study. And these are equally important. Includes adherence and persistence to ribociclib, treatment satisfaction, changes in health-related quality of life, work productivity, and a number of other measures that you can see listed here. So quite a bit of data collection, but we have really worked very closely with patient advocates for input on the study design to make sure that we are not burdening patients too much in terms of their burden of filling out different patient-reported outcome forms. And as you see here, very much a global endeavor to make sure that we're capturing real-world data in this patient population. And this is the prospective data collection of all the times that PROs will be collected. So why this is important is that we are continuing to really look at how patients do with additional adjuvant targeted therapy in the real world. This is important as new agents are approved, to have a better understanding of how patients outside of a clinical trial actually do with these agents. What does the toxicity burden look like? What are the effects on quality of life? And all of these will help us both improve our supportive care strategies for these patients and also help design better studies in the future to address unmet needs. So thank you